Well, hello everybody and welcome to this webinar from the ISO Occupational Health and Safety Management Committee, ISO TC 283, with this session on preventing and managing disruption from infectious diseases and why we really should be thinking about preventing and managing those diseases in our workplace. I'm going to go through a little bit of housekeeping before we get started, and then we'll get underway. This is a listen-only webinar, so you won't be able to verbally talk to us. It's being recorded, but please let's make it interactive. Use the question and answer function to submit questions, comments, anything you like to interact with the experts on the panel today. We will answer your questions throughout the session, so please don't wait until the end. We quite often get involved in our conversations and run out of time. So if you wait until the end, we might not get a chance to answer your questions. Do let us know also if you're having any technical difficulties, for example, with sound or images. Our technical team are in the background waiting to help you, and they're usually able to resolve these issues. This is a CPD recognised event, and you can request your certificate when you fill in the feedback survey that follows the event. Slides will also be sent to you once you've completed that survey, and you'll also have access to the recording, and in due course the recording will also be available on demand to anybody. Thank you for that, and without further ado, let's get started. I'm going to introduce myself whilst the rest of our panelists turn on their cameras, and then they will introduce themselves too. My name is Sally Swindwood. I'm the Committee Manager for ISO TC 283, and I'm a Lead Standards Development Manager for the UK's national standards body, BSI. Now, Troy, if you would like to introduce yourself, please.
Thank you, Sally. My name is Troy Winters. I am the Senior Health and Safety Officer for the Canadian Union of Public Employees, based in Ottawa. I'm coming to you from live from Vancouver this morning at a hotel, though. I'm project lead for the TC that's developing this this standard, and yeah, I'm looking forward to today's presentation.
Thank you very much, Troy. And Maria Nieves, please.
Good afternoon from the north part of Spain, in the Basque Country. I'm working from the Basque Institute for Occupational Health and Safety at Work, and I mostly dedicated my time to industrial hygiene, and well, I'm working in the group developing the ISO 456. So I'm looking forward to this webinar. Thank you.
Thank you very much. And Constance, please.
Hello, everyone. I'm Constance Eheze, and I'm a lecturer in business and management in the Leicester Business Castle, de Montfort University. I'm also a doctoral researcher focusing on the health and safety management, representation, and strategic leadership and governance.
Thank you very much, Constance. So let's begin with a very high level question, and I'm going to argue with my cat first of all, apparently, who's not making this easy for me. Why do organizations need to manage infectious diseases all the time and not just in a pandemic? Maria Nieves, perhaps I can come to you first. The pandemic alerted us to what is actually an ongoing health and safety issue, but are we perhaps losing some of the good practices we learned during the height of the pandemic?
Well, I think the pandemic has shown us that we have to manage to do something about the diseases that are not quite related to the work that we are doing. And I think they are losing it because we have forgotten what we have to do to make a front to the pandemic that we have had. And well, this is still here. We are not talking about it. We don't want to talk about it, but it's here. But people is not thinking. think that we have finished with that we are not going to do anything and there are not other problems here. And well, the flu has arrived and up to now we have done nothing about it. And I think that we have to think about doing something because we don't want everybody to get the flu, for example. So I think that we have to think about the biological agents that are outside in our environment, and the same way that they think about other things that are in the environment that are not related to work, but as we are working there, we have to think about them. So I think that we have to keep them in mind.
Thank you very much. And Troy, perhaps you can help our audience understand just what kind of range of disease we need to be thinking about when we talk about infectious diseases.
Sure, and you know, just to build a bit on what Maria was saying, I think for a really long time we really normalized the practice of getting what we'll call non-serious, non-life-threatening illnesses when we go to work, the common cold, seasonal flu, and in fact we to take it one step further, we encouraged people to even come to sick. We said, great job if you showed up even when you were sick, because you were there and you were working hard to be part of the team. I'm hoping that we've learned our lesson in the past couple of years, that this actually isn't a good practice, and that even general and mild illnesses, things like the common cold, things like the seasonal flu, other things that may be endemic to a location, these are things that the employer can take steps to control. And for folks that are familiar with the international standard on safety management systems, which is kind of our overarching, our kind of North Star when we develop some other guidance material. One of the first things written there for the responsibilities of the employer is to ensure that they are taking overall responsibility for preventing injury and illness. And it doesn't say illness that ultimately will kill you. Obviously those words are important. It's really talking about all forms of illness, I think, and so we really do want to see all of those forms of illnesses, prevented when they can. And obviously, I don't expect, especially small and medium enterprises, to be responsible for eradicating the seasonal flu. Certainly, that would be a bridge too far. But I definitely think there are common sense things that we can do that we've learned work. And because in large swaths of the world, we didn't eliminate the flu, but we had a lot less seasonal flu because of the protections that we were doing for COVID. So thinking about some of the internal and external factors, we can come back to those a little bit later. It really is, I hope, a new way of thinking about keeping people safe, even from what we used to consider minor illnesses. And we'll talk more later about some of the good reasons why they should do that, of course.
Thank you, Troy. And what the title of this session was about disruption. So perhaps I could ask you, Constance, you're lecturing at a business school. Why is it disruptive to not manage infectious disease? When we don't manage it, when people do come into work, when they're sick, for example, how is that bad for business?
Okay, thank you, Sally. I mean, when this infectious disease is spread, let's take, for instance, COVID, the COVID-19 pandemic. On the average, I mean, globally, students are 8 months behind where they would have been absent. That's before the COVID-19 pandemic. But the impact actually varies widely across industries, right? We estimate that by 2040, unfinished learning due to the COVID-19, it could translate to the annual loss of about $1.6 billion of the global economy. I mean, that's quite a lot, right? If infectious diseases are actually left to linger, if they're not, like we'll say, nipped in the bud, caught on time, it could spread across the business, across different phases of the business. Let's take, for instance, look at the employees. Right, with COVID-19, yes, we might say, oh, COVID-19 is gradually becoming an issue of the past. But just like COVID-19, all pandemics and all illnesses may not just stop. they might fade off, they might tail off, you know, they would linger for a while. And in that period, you have employees that are sick days off, people are absent from work, you have employees, some might die. Your workforce is being reduced. If we take it over to the supply chain, right? When we look at COVID-19, there was a lockdown, international, nationally, locally, there was a lockdown and things could not work. Your supply chain is affected. Businesses are losing money by the day. If you look at customers, it affects your customer base as well. Right. So generally, I think that just leaving infections, you know, not attending to infections in a timely manner actually would cost the business, not just potential disruption, but also if you relate it to the well-being and the health of your employee as well.
Thank you, Constance. And I have to say, I was having some conversations in the last few days about Bristol in the UK, where the person I was talking to is actually noticing a significant number of businesses are currently closed because of staff illness. And this is exactly why we are looking at this subject, because that doesn't need to happen, does it? As I think it was you saying, Troy, you know, this idea that you still come to work and it's a good thing if you've got a cold or the flu. Perhaps we've slipped a little bit back to that, and it's just like, no, we're very busy, you must come in. Oh, now everybody's ill and can't come in. So it's on every level, and the smaller your organization, the bigger the impact that's going to have, I guess, because there are less people to take the place of the sick people. So let's go on and talk a little bit about ISO 45006, the guidance document that we are writing. Troy, tell us a little bit more about that, and perhaps build on that conversation we've just been having about disruption.
Sure, and I'm going to apologize ahead of time because this is a bit of a long answer. So, but I really do want folks to understand what we're attempting to do with this guidance standard. So, you know, a little bit of history. You know, some folks may be aware that in 2020 that this technical committee, we got together and very quickly put out a publicly available standard on how to provide some guidance for dealing with COVID across various organizations. And after we did that, we really didn't want to lose the momentum, because we had assembled a really great team, actually a very, you know, in my view, a really fun team to work with. You know, internationally, that had some great experiences, some great knowledge. So we proposed and was successful, and we moved on to developing a general document for the control of infectious disease, because we didn't want to, you know, lose all of this, you know, all of these learnings that we were going through at the time. And what seems like, you know, it seemed like just, you know, 5 minutes ago when we started this standard, you know, two years have passed, and really we wanted to put together a document that really it was applicable to, you know, all size organizations. We, you know, obviously, you know, larger organizations have more resources, but smaller organizations, this, you know, we really wanted to keep those in mind when we were developing this, to help provide some guidance for small and medium organizations. And you know, the overall focus, of course, is you know, any illness that may, you know, cause impact to health or disrupt the operations of the organization. And really, as you read through the document, it's not quite an exact step-by-step process, but that's kind of how we wanted to lay it out. So really, we want organizations to start by taking stock of all of the potential infectious diseases, infectious illnesses that their workers may come in contact to. And we made it very clear that this is not just the four walls of your main headquarters organization. We we want them to consider wherever workers go. So if you have workers that go into home care and go into other people's homes, that's important. If you have people that travel internationally into other areas where, you know, there's different endemic diseases, we want you to consider that. So it's really, you know, wherever workers may travel, we want those to be counted in there. And then once we have a kind of a full collection of all of the potential illnesses, then we really want you to take, you know, to move to that next step in the health and safety process and really assess the risk of those things. So of course, ultimately we want to prevent exposure whenever possible, because if you prevent exposure, then obviously nobody gets sick. You know, and in the hierarchy of controls, that's our goal. But of course, we can't prevent all exposure, so we really need to dig into the details. So once you have your full, you know, understanding of the potential, you know, infectious illnesses, we really need you to look at things like the virulence, look at how they're transmitted, the likelihood of transmission. How likely is it that the activities of your organization will put a worker in a place where they could be exposed and where the illness could be transmitted? Things like the incubation period. So how long from infection to when you start to see symptoms, and whether those symptoms are occurring before or after somebody could transmit the illness. And of course, we had lots of conversations around that during COVID for sure. You know, and what are the symptoms? Of course, you know, can you even see symptoms when a person gets it? And you know, things like that. All of that is relative to, you know, the considerations that the employers can put in for their controls. And I mentioned the hierarchy of controls. Of course, we want to make sure that people use the best controls. But you know, when it comes to infectious disease, of course, you know, personal protective equipment tends to play an outsized role, even though we generally consider personal protective equipment to be a lower, you know, kind of line of last resort when you can't engineer things out. You know, there's quite a bit of prominence, so we do talk quite a bit around, you know, things around like personal protective equipment. But we do spend a lot of time on other controls, like using, you know, controlling the flow of people, you know, having, you know, not you know, working at home when possible and things. So we really do try to explore all of the options. Yeah, I think that about covers it. Because really, it's really just about the businesses looking at the impact and the potential corrections that they can put in place. Because you can't do anything about the external factors that are out there. You know, what circulates in the environment is beyond your control, but you can absolutely help. Even, you know, some of the stuff is fairly simple to help reduce some of the spread that would be inside of your organization.
So let's have a look at the scope of the standard, Troy, and perhaps we can just talk through that. And I might come to Maria Nieves afterwards to explain a little bit about how we got to this scope, because we went a little bit backwards and forwards, didn't we, to determine exactly what this document covers.
Yeah, and we wanted to make it you know, clear. We're not writing a standard to tell hospitals or tell a research lab that deals with, you know, level 3, level 4 microorganisms how they should be doing their infectious disease control. They likely have very robust, very complex, very, you know, successful infectious disease programs. But you know, perhaps there's a trick or two that they can pick up from our standard that would be useful. But that wasn't our focus. So you know, large or hospitals generally, medical facilities that, you know, especially where they've been legislated, where they have national standards, where they have national regulations. You know, we're not here to replace those or overstep those. But I am hopeful that maybe, you know, we have a trick or two maybe they can take with them to help out a bit.
So much like with ISO PAS 45005, the safe working guidance for the COVID-19 pandemic, this is general guidance, isn't it? It's general guidance that anybody can pick up and use and learn from for their situation, rather than, as you say, those very high-risk environments where there's already protocols in place, legislation in place. We're talking about ordinary people doing ordinary jobs, however extraordinary those jobs are, but not necessarily jobs where they are exposed to pathogens on a daily basis, which is a different level of control. Maria Nieves, we've got these 2 dash points in our scope, that it is about illnesses that can kill you. For example, the COVID-19 pandemic, when it first started, we didn't know what we were dealing with. A lot of people were dying. People are still dying, of course, across the world. So it does deal with that kind of thing, but it also deals with those lower risk ones that Troy's already mentioned, like the common cold, but that can have a significant impact on the organisation, on its workers, and on other people, which can include, of course, the public. Do you want to say anything about how we got to that place?
Well, we have a long discussion about it because we have in the group a mix of people, and each of one of us has different views and different knowledge about these kind of things, and we wanted to make it good for everybody. And I think that we started thinking about COVID all the time because we have the COVID over there, and we were a bit directed by it because we were living it, and we wanted to, and everything in the news was COVID. And but then we thought that it was not only important to think about what is the some risky disease that could be have consequences like that, or a very severe ill health. And we wanted to look at the other part, that we are not thinking about dying, but we are thinking about a great disruption for the work, where you are unable to develop your process. You can't do anything, and even you can be a risk for the public or the people going inside the organization. So we decided to open the scope of the standard to all the possibilities, and we wanted to represent it from the high risk to the common thing that will be affect all of us without no severe consequences, but could be another kind of consequences that could be not working, or the closing of the installation, on a kind of things. And we also, although I think is afterwards, we are not only thinking about what is coming from outside, something that can appear inside too, or related to what we have inside. So it's a bit of everything.
So it is very much about raising awareness, educating people to really think slightly differently, isn't it? To perhaps not just accept. If we can go to the next slide, please. We've touched on it already, but I want to delve a little bit deeper into, do we just have to accept seasonal illnesses, things that come around year after year after year, and one person in your workplace gets the flu or gets a stomach upset, for example, and we just go, oh, here we go. And within a week, 4 or 5 people have it, or 10 people, or 30 people, depending on the kind of interactions you have. Is this something we've just got to accept as workers? Should we be putting up with that and just go, oh, I'm going to get ill because I'm going to work? Or can we do something different? We did learn things during the pandemic. Is it inevitable that it has to spread, Maria?
I think that we have to use what we have learned with the pandemic. I don't think we have to accept now that somebody with the flu is coming to the office, and in 2 days 4 people are caught with the flu. I think that we were talking this morning here in the office that we should think about the mask again. So we are not thinking about that. We are finished with the mask. I don't think we are finished with the mask. And related to this, we are thinking about there is no consequences of these kind of things. But just last week, when I was thinking of preparing something to this webinar, I read a piece of news that was published in the USA Today, in the newspaper of the United States of America, and it was related to an article published in the magazine Nature, and they are saying in that kind of in this article that even we are thinking that there is the illness that we have caught is quite nothing like the flu or another virus or the mononucleosis, the KISS have the kiss illness that is called like that, they can have for some people severe consequences. So we don't know what kind of genetic structure of fail we have to be affected by something severe in several years because we got the flu or we got the kiss illness or something like that. So we have to change our way of thinking. We have to think that we cannot accept that the flu is something that can happen and everybody is going to get it. And if it was in our hands to make something or to do something to prevent people getting ill, we have to do it. And we have to try to ask people to use the mask with the flu. I think we have to think about that to make it again, because we have to go back to using the ventilation system that was before the pandemic, and perhaps we have to think again about putting a higher ventilation level or something like that. So I think that we have to change our thinking paradigm, because things are not the same than it was before, or at least we have learned that things should not be like that.
And I'm really glad you brought that up. We are quite dismissive, aren't we, of the flu, and yet it kills many, many people every single year. And I am concerned that our view about COVID-19 is becoming the same kind of, oh, I've got COVID again. And we forget this is a disease that can kill people and does kill people. It regularly hospitalizes people. So just because we're familiar with it doesn't mean that we should be incautious about it. Simple ideas, as you say, about let's start wearing masks again, let's remind people to wash their hands, let's keep a bit of distance, ventilate our workplaces. Constance, you mentioned that your research at the moment is about OH&S management representation in leadership and the importance of this. And I've got a question coming in from the audience, which seems to be related to this. Do you think the old standard of going to work when you're ill has been financially driven because people worry about losing money? Workers worry about losing money by being off ill, and organizations worry about losing money if people take time off sick. Do you think, is this a leadership issue? Is it a top management issue?
Okay, yeah. So I would look at it, first of all, if we look at leadership commitment. Sally, I'm gonna give an example right down the line, because I actually had a scenario like this. It actually prompted my research. You know, it prompted why I went into do my research in this area. You know, I love to use the words, if we know better, we will do better, right? So if occasionally you find people, yes, people say, oh, I have a flu, but it's just a flu, I'll go to work because I don't want to take days off sick and I might not get paid, right? So when the pandemic just hit in 2019, just about 2019, into 2020, yeah, about that time, 2020 thereabout, I was working with an organization, a total real estate solution company at the time, and it was it had a pretty large number of employees, over 1,000 across 14 different countries. And I worked as in the capacity of head health and safety management at the time. But health and safety sat under the corporate service directorate at the time, right? So there was no direct representation of health and safety. By that, I mean, there was no health and safety practitioner on the board. So everything that health and safety had to do or say had to go through the corporate service director, right? And I mean, in her capacity, she was a lawyer, you know, very great, amazing colleague at the time. So when COVID-19 hit, when the first case of COVID-19 was recorded in Africa, I had a meeting with her and we sat and discussed quite a bit, you know, to say, okay, now Africa has recorded the first case, and it will be time for us to, firstly, we need to review the business continuity plan with an input from all stakeholders as soon as possible, right? And then look at engineering, administrative controls, all of this in place to ensure that, you know, we do not get a spread, and best possibly ensure we do not get a case at the time, right? But I mean, it was to her, it was a burden, right? It was a financial burden at the time, because like people would say, oh, health and safety, usually you just have expenses, and you know, for those that know better, they understand that health and safety is not just an expense, because it saves the business at the long run, right? If you look at the risk holistically, you see where health and safety sits, and see that, I mean, in business continuity risk, in financial risk, in reputational risk, health and safety is seated right there. So we had that conversation, and of course she told me, oh, at this time organizations are actually just trying to stay afloat. We haven't got that kind of money to go around fixing screens and shields and then PPEs. And I said to her, eventually we need to get solutions that will enable the workforce to fade into remote working, because we would have to. I mean, when you come to a workplace, some people commute publicly, some people come privately to work. So however, we need to now put things in place to ensure, to reduce the risk of having a case in the workplace. Okay, so that was that. She went to the board and came back and said, oh, sorry, we're not considering that at the time. Eventually, 1 month or 5 weeks down the line, we recorded a case, right? And one case became 2, right? So at this time, top management is saying, oh my God, we can't afford for this. Oh, what do we do? And I mean, you know, when COVID-19 first hit, it was vague. People didn't know what to expect. People died of it. People were badly hospitalized. So everyone was scared. And at that point, first, the director stopped coming to work. Remember 5 weeks ago, we said, can we start getting solutions to fade the workforce into remote working? At this time, we would have been able to get around it, okay? But, I mean, top management stopped coming to work, and then workers became scared. You know, everyone thought, oh, the top management isn't coming. Why do I have to come? Why do I have to risk my life? So back to your question, I think that, you know, with issues like this, leadership commitment, top management commitment is very important to drive it home. If you are sick, stay at home. Right? If we have a policy like that in place, if you're sick, stay at home. You're not just saving yourself, you're saving every other person in the workplace. You're saving the business at large. You're saving the community at large, because you might interface with the customer, you might interface with another colleague, and that's how the infection spreads, right? So it's important. Leadership, leadership commitment is very important in actually curtailing infections. Thank you.
Thank you. I was trying to unmute somebody who wasn't me and wondering why it wasn't working. Thank you ever so much, Constance. And I think this is, I'm going to come to you in a moment, Troy. I want to talk more about these business benefits, but I think it's really highlighted a bigger issue there, because from an organizational point of view and from a human point of view, not coming to work when you're sick really does make sense, because if sick workers come in, there's going to be more sick workers. That is going to affect productivity. It's going to affect what the organization can do, and more people get sick. However, this question that we originally got is at least in part about unpaid sick leave, isn't it? And people who may not be on traditional employment contracts. They're self-employed, or they work for a platform organization like Uber, They have no protections when they're off sick. And I don't know what the answer to that is, but I'm going to come to Troy because I know you've had these conversations, Troy. What do you think are still the benefits of taking this approach that you should not be working when you're sick?
Yeah, so there's really so many different tentacles into this conversation, because as Constance was saying, it comes down to leadership, and leadership can say, yeah, you got to stay home if you're sick, but if you don't have the paid sick leave, or your job is precarious. We have so many precarious, even outside of the platform economy, we have so much precarious employment, part-time, non-full-time hours type of employment where you need that extra 4 hours. If you're there, that 4 hours is the difference between you having food security for yourself or your family, or making the rent, and being able to have a roof over your head. But then you have sometimes conflicting policies and practices in the same organization, whereas if you miss 1 or 2 days, you get brought in for an attendance management meeting, and they're like, well, you missed some days. Well, we're going to start tracking this now. So now we're having an impact not only on your physical health because you're sick and you can't stay home and recover, and yes, you're infecting other people, but now we have a psychological damage being done, because now you're stressing out. Oh, I got to get to work. I got to get to work. I can't stay home. So and again, I understand some organizations don't have the resources to have full benefit massive sick plans, but I think there's a role for government here as well, and this is something that we've been exploring in Canada. What is the role of government related to especially things around a pandemic or a massive outbreak? Where do things like potentially workers' compensation be able to fill some of the gaps, and kind of spread the pain around for all organizations pay into the workers' compensation system here, and not all of them, but that's a whole other conversation for a different webinar. But many organizations pay into the compensation system, and could that even out the risk for organizations if we could manage a sick bank for organizations that can't fund their own sick leave or short-term disability type of programs? That may be another solution. And again, I'm not saying it's the right or the wrong one. It's just another thing we can explore, because like Constance said, and like how many organizations can afford 2 people being gone for 3 days, or 4 people being gone or 7 people being gone for a whole week, because that's what's going to happen if you don't have the rest of the supports to back up this if you're sick stay home mentality, which is where we should be going. But with all the other competing things, it's going to be a lot harder to get there, and it's really important, I think, that eventually we do find our way there, because it really is, to the initial question, which is workers shouldn't expect to get sick because they go in during flu season. That should be an expectation that workers have, that we will take the at least the minor precautions of turning up the air, making more changing out the filters, putting in the proper filters, just having people wear source control level surgical masks when we're gathering in groups. There are things that we can do, and they're not particularly controversial. They shouldn't be particularly controversial. They shouldn't be political. Unfortunately, that's a whole other side of things. But I think it's very reasonable to expect that you don't get sick when you go to work.
And this really is, we're very beautifully illustrating that allowing your workers to get sick is causing all sorts of problems, isn't it? So if we can do things to stop that happening in the first place, then issues like financial concerns, whether it's to put in screens and provide masks and things in Constance's example, or in the worker who turns up because they need that money, they need those hours work, those days work, or they can't feed their family, they can't keep their home. Preventing that sickness in the first place seems to be the answer to those things. Then we don't have to worry about them so much. We do have a question that's come in. Back to governments. Troy, you brought it up. Didn't want to get political, but we might need to. Do the panel think the action of governments actively affects workers' decisions? For example, advocating or not the use of masks, providing free testing or not, mandating quarantine periods or not. How much do you think that is affecting what we all do in the workplace? And how much do you think we could get over those political vagaries, the differences, the changes in legislation and opinion, depending on who's in charge, through organisational management? And that was a lot of words. I was going to come to Maria Nieves, but if you don't understand what I'm asking you, do tell me, because I kept talking.
Well, I think that the pandemic, with all the changes, as you say, of legislation, of measures that they have to go, first there was no need of the mask, then the mask was mandatory. That was you were ill, you have to quarantine. Then if you were ill and the quarantine was 10 days, there were 7, there were 5. Then if there was no symptoms, you can go to work. I think that they have affected the organization, but they have taken what they wanted because they were interested in it. Because if it was not necessary to quarantine, but an organization can decide that you have to quarantine, because it is not necessary for the government, but this, as an organization, you can decide to do that, and you can decide to continue with the mask. And I think that one of the problems that have been with the pandemic, I don't know what would have happened if the pandemic was not born in China, because I think that the pandemic was not born in China, the COVID-19. Perhaps the mask would have been something to be used from the first day, because in my opinion, the mask couldn't not be used or should not be used because there were no masks to buy. Although when we could buy it, we could make one at home. For me, it was quite difficult to understand why I couldn't make a mask before and then I couldn't make a mask at home. But I think that a problem has been how the government has been changing the criteria. And I think the organizations have taken the criteria of the government because they were interested in that, because the criteria of the government at the end, I think, in many cases will be mostly economic. And what we wanted were the organizations, the business start to again to work, and everybody has taken all the measures that will be made possible to start working or to continue working. And I think in some cases the health issue has been left aside, and it has taken and I remember last year in the Congress that was in Canada, where you were also present, Troy, and it was a great discussion. Well, not a great discussion, but it was a great, I don't know the word in English, sorry, but a lot of people working in occupational health and in this area were saying that one of the great problems in the pandemic has been that the health service or the public service, the health public service, has taken it in their hands the pandemic, and they have forgotten all the knowledge of the occupational health had about how to manage an biological agent in a place, basically in the area of industrial hygiene. And I think that's been a problem because they have seen it only as a public problem, and they haven't thought about the organization, and they have mix of the knowledge of that. So I think we have to learn from the errors that we have made with the pandemic, of the COVID pandemic, and take into account other things if we unfortunately have another one that they are saying that it will come. Let's hope that in a long time. But I think that it had been a problem, and the organization had taken what they were interested in, and in some cases only thinking about the work, that in some way is also important, because if there was no war, nobody was going to cut the salary or the pay. And it was a fish, well, in Spanish it is said that it's a fish that is getting his tail. it started and not finished, so it's difficult to know. But I think that the government was not, in general, the government was not very good on managing this kind of pandemic.
Thank you. And I feel like we could talk about this a lot for the rest of the session and never get on to anything else. So I am going to move us on in just a moment. But I think you brought up an interesting point there that is worth just saying a little bit more about the belief, the perception that infectious diseases, contagious infectious diseases particularly, are a public health problem rather than an occupational health problem. And we've certainly had a lot of these conversations when we were writing the Safe Working Guidance, as well as 45006. We are human beings. We operate in the public, and we have friends, and we have families, and we have communities, and we go to the shops, we go to our doctor's offices. We are moving around when we are not at work. And so anything that's in the public arena, we will take to work with us. And anything at work is going to come home into the community. And I think this is a really important point when we are thinking about occupational health and safety management generally. Remember, we're dealing with people. We're not dealing with robots. We don't lock people in their workplace switch their button off so they stop moving when they're not on shift. This is a holistic problem or challenge, and only by looking at it in that way are we ever going to make any progress, because there are no clear lines between at work and not at work when it comes to health. Anyway, we do need to move on. My little hobby horse, I apologise. Let's have a look now at infectious diseases that are not contagious. You know, we've had the last 2 years, we have talked about COVID, and now we're talking about flu and RSV and other contagious diseases, but it's a much bigger subject than that, isn't it? Troy, what else should we be thinking about? What else do organisations need to manage?
Yeah, this was actually I'm going to say a complex point of discussion, but one that we had to keep pulling ourselves back to as we were developing this document, because there are so many, you know, and this was even some of the criticism we got early on. People would say, "Well, you're just writing a COVID document," and I said, "No, you're just reading it because, you know, COVID's on your mind." Think about how all of these non-contagious infectious diseases will be impacted. So we think about things that are like foodborne, for example. So in places where people are preparing food, or where, you know, even where workers, you know, consume food that has been provided by the employer, we have things like salmonella and E. coli and the bacteria that causes botulism and listeria. We have illnesses that are, you know, just, you know, spread through insects, Zika, West Nile virus. You know, and you know, how you know, just to tie into some of the other workshops that I know that are going on this week, thinking about how the, you know, climate change is changing the external factors of risk. You know, we never used to have West Nile virus in Canada, but now as things are warming, we find more and more cases every year. You know, things around like malaria and other fevers, some parasites that are in water. You know, some of them are you know, considered contagious, but other parasites, you know, that are just in water. Other waterborne illnesses. It just popped out of my mind. Legionnaire's illness caused by Legionella bacteria that, you know, when the water dries, gets released into the air. So again, thinking about how all of these, you know, we had a huge outbreak of Legionella in Ottawa a few years back. A lot of the federally owned buildings that got into the water system, and they had to do a lot of purging of the water systems. So it's not just protecting, you know, it's not always just protecting the persons from other people. It's thinking about all of those other aspects and how can we control. And those aren't going to be mostly personal protective equipment. Those are going to be things that we want to stop at the source, using engineering controls and using administrative controls, you know, whenever we can. So that's kind of the other type of illnesses that we wanted to make sure we definitely covered off. and people's considerations when they're thinking about the infectious diseases that are potentially enter the workplace.
Yeah, absolutely. And Maria Nieves, maybe you can tell us a little bit more about infectious diseases that are related to infrastructure, buildings, the physical environment. What are the kind of things that people should be thinking about, and what do they need to do to manage that kind of non-contagious illness?
Well, one of the most common or more known disease related to the installation is the one that Troy has mentioned, is the Legionella disease that is related to Legionella in water, and it's quite it's not typical, it's not very extended, but there can be many cases every year in almost every country, at least in Spain there are. And in Spain, for example, it's considered quite important disease because there is legislation specific for Legionella. And even having that, a lot of organizations doesn't know anything about it. So we have the Legionella with the water. We have the molds related to water too, that there is, it appears because there's some leak of water in the infrastructure, and they can grow and they can create some problems. Then we have another, mostly they are the fungi, was the mold, but then we have some kind of fungi, and one is related to, usually not in the installation, but come inside through the ventilation system, and can cause some kind of problems with the population inside the building. And that can be very severe if they are in the hospital, and it's the Aspergillus mold and fungi, sorry. And for example, the last week in the news, they appeared, the World Health Organization was saying that the world is not prepared to have a pandemic created by the fungi. And one of the fungi that they mentioned was the Aspergillus. But I don't think that to have a pandemic, for me, in this case, it's quite difficult to see, because it's something related to a place, and for the moment, it's not something that is a contagious disease. So to extend it to the whole world, for me, at this moment, it's difficult to see. But mostly there are things related to molds, to fungi, and well, another kind of bacteria that could appear in the water. That is the most important disease that you can have related to the installation of an organization. So we have to look for the water, we have to look for leaks in the structure, we have to think of filtering very well the air coming from outside. So in order not to put it inside the installation, and so we have to be very aware what our environment is, and to take care of our installation in the way that, well, everything is as it should to be, and there is not something that we see that is not well, and we leave it thinking that it will be nothing to the workers.
Thank you very much. And you know, we have just been talking about environments, and we're thinking about workplaces as buildings. They're not always that, of course. Constance, what about people who travel around for work? There are people who travel all over the world for work from one place. Troy, right now, not at home, you know, and Canada's a big place. He's still in the country, but he went a lot of distance to get where he is now. What are the kind of things organisations should be doing to protect their travelling workers? They don't have particular control over the places those workers are going to, but they do have other tools in their toolbox, don't they, to help protect the workers as they travel. What kind of tips and guidance would you give to an organisation who has workers that travel?
Okay, so let's permit me to borrow the clause 7 of the ISO 45001. You know, that's the clause for it. It talks about support. So I mean, for workers that are traveling all around for work, sometimes they may not be able to, some workers don't just work in one location, and the world has made it even easier today. You could work from anywhere, you know, just like Troy and every one of us. I mean, and Sally, I guess, you know, you could work from any location. But one primary thing remains, and I say that organizations should actually be able to provide safe tools and equipment, right, for their workers and all of the necessary resources. And for me, the most important part of this is staff training. Right, staff training at regular intervals. You need to train your staff on what's expected. You need to help them. You need to train them to understand the best, the safe method to do work. You know, the safe method to work. Okay, while you're at this, I need to give you travel guidance. Right, ensure you wear your mask, ensure you sanitize your hands 2 meters apart, and things like that. Adequate communication of what they should and should not do. Because whether we accept it or not, people would work away from where you would ordinarily be able to see them as an organization. I mean, sometimes before now, we used to have things like spot checks. You would want to check up on the employee to see what they're doing and how they're doing it. Are they sticking to the procedures that have been stated? But nowadays, you may not necessarily be able to do that. But so the highest and the best we can rely on is staff training and ensuring that management provides the adequate tools and equipments and also resources to enable the worker to do their jobs safely and right. Thank you.
Thanks, Constance. And if we can go to the next slide, please. I'm not going to quite ask the question on it yet, Troy, so be prepared. I'm going to build on what Constance has just been talking about, and it's something that in developing 45,006 we have talked about, isn't it? Some diseases are endemic in one country. They're there all the time. The local population knows how to deal with it. They know what to look out for. They know how to protect themselves. And then we send Troy off to visit that country. And he doesn't have any natural immunity to those endemic diseases. He's not familiar with what the risks are, what the hazards are from that disease. Knowledge is a really big part of managing infectious diseases, isn't it, for work? Can you say something perhaps about building up what Constance said and the training? We've also got vaccinations. We've also got preventative medication like you might take for malaria, but also the way you behave and things like that, which very much fits into the training. But it is very much about this awareness as well, isn't it? That is a control.
Yeah, absolutely. And it's awareness and it's general knowledge. If you know that if you're opening up supply chains into a new area of the world, or you're opening up new business opportunities and going to be sending some folks in that direction, then you really should get in contact with the people who know, with the folks that are living in that industry. So one of the great things I get to do is I work with flight attendants. We have a lot of flight attendants in the union, and that's one thing that we're always staying on top of, and we're always getting always checking in with the companies about new and emerging things. So for example, when Zika first started appearing in South America, of course we had a lot of concern. We didn't know what this new thing was, how it impacted, who it impacted, and things like that. And that was one of the first things we did. We went to, obviously we were doing our own research as representing our members, but we went straight to the company and like, well, what do you know? What have you heard? What's on the ground? And they have links to security firms and to medical practitioners, and there's global networks, things. There's a company called MedAir, which is a global support network for airlines that they tie all that information together and make sure that people are aware. Also governments, of course, you know, I don't know how it works around everywhere, but certainly the Canadian government puts information up about traveling to different areas. And if you're going to those areas, absolutely check, know what, you know, proactive medicine you need to take, know what the right vaccines are, because there are illnesses out there, like you said, I've never been exposed to, but you know, and that's why, you know, that's the great thing about the vaccines that have been around forever, is they'll keep you safe. And yeah, I don't think I have anything else to say than that.
Well, that's fair enough, Troy. No problem at all. And Maria Nieves, the standard does talk about planning, preparation, looking forwards, doesn't it? COVID-19 took the world by surprise. Many countries, many organisations had done pandemic planning, disaster planning, and it still didn't work. And we still fell apart in many places. What can organisations do to make sure that next time there is a global outbreak or a global threat of an outbreak from a disease, we are better prepared for new diseases, emerging diseases, a resurgence of a disease that we've forgotten about? What can we do?
Well, I think we will think that we are going to have a pandemic again. For one part, we have to be prepared to know about what is happening in the world. But if we want to be prepared for something that we have had, we have to think that we are going to have another one, and to think what we need to have in our organization to be able to continue working if another thing like that happens. If we are not prepared now, we are not going to be prepared when the pandemic comes, if another one comes, or if not at least a pandemic, it will be an epidemic. Because as I've said several times when we were working in our group, the flu is epidemic every year. And in many places, that epidemic stops the many works, many organizations, because they have a lot of people ill, and they are not prepared for that. So I think that we have to think in a pandemic mode and prepare everything to answer to something similar to a pandemic that we know. So we have done a lot of things, we have learned a lot of things, and perhaps there will come a different thing. But if the problem is it can come something different, but if it's not contagious, we are not having to have this kind of problem, because we have some people ill and we have to try to get them well, but it was not a spread. So our problem is something similar to the pandemic, to the COVID-19. So I think that we have to think in that kind of wave. So we have to be prepared to be able to stop the spreading in our organization. And to think of that, we have to think about how to better our ventilation system, have to think about how our work is more separated. And it's a problem because nowadays it's quite difficult to get the space to put a new installation. Nobody wants to have a chemical plant around. So to find a space for them is difficult. They have to manage in the less space that they can. And in the pandemic mode, that will be more difficult to maintain the people safe, because they are going to be quite together. So we have to think that we have a pandemic not very far, and to prepare everything to be able to answer to a new pandemic, but thinking we have learned with the COVID-19, I think.
Yeah, thank you very much. And Troy mentioned earlier some of the occupational health and safety risks from climate change. And the climate has already changed. It is changing much faster than the scientists anticipated it was going to change, even 2 or 3 years ago. And that change is going to continue to accelerate. Part of the concern with that is there will be new diseases. Habitats are going to change. Animals, insects, the rest that live in a certain part of the world now are going to be interacting with human beings in a way that they never previously needed to, because they had somewhere else to live where human beings did not, for example. Constance, can you give any kind of general advice on how, from a business point of view, from an organizational point of view, people can manage with this constant evolution, disruption, potential threat, where we don't know what the threat looks like yet, but we know that those threats are there and they're coming? Is there any general advice you can give to people?
Yeah, okay. So, just like Maria said, we can't, and you mentioned as well, we can't be so sure of what next is coming. We don't know of what the next major threat could be. We don't know what the next pandemic could be, right? But the best that we can do at this time is to ensure that we have a comprehensive emergency preparedness plan in place as a business. I mean, an emergency preparedness plan that's crafted to actually address health crisis, infections, pandemics, right? We have to constantly, a continuous monitoring of the occupational health and safety conditions, and then put in place appropriate risk assessment to ensure that, these control measures are constantly being adapted to evolving processes, because our processes are evolving, right? You just talked about climate change. A lot is going to happen. Animals are going to interact with humans in a way that they may not have had to. Humans are going to take up spaces that they may not have taken up in the last 3 decades or 4 decades or time ago. So new threats and new risks are still going to be introduced. But the best that we can do is to ensure that we are prepared. We put things in place to ensure that we can address these issues, processes that are evolving, conditions of work, and the characteristics of the workforce, so that, reoccurrences can be prevented, and even new occurrences can actually be nipped in the bud, if you understand what I mean. Yeah. All right.
Thank you. And one thing we haven't really mentioned there is we had our climate change and health and safety risks debate yesterday, and the climate change expert was saying one of the things that we keep forgetting about is there are going to be less habitable places on Earth in next decades, which means there's going to be more and more people squashed into a smaller and smaller space. And if we're talking contagious disease, that's an issue. That's going to make very happy breeding ground for those viruses, those diseases that go from person to person. But in developing this document, 45,006, we have talked about, there's a lot of common controls, aren't there? Contagious or non-contagious. Doesn't matter what the characteristics of the disease are, there are things that we can be doing all the time that will give us better protection. Might not be complete protection, it might not suit all of the ways that things get transmitted, but it will help. So I would like us to explore a little bit about that. And one of our 45,006 experts who is on the call, attending and listening in, has reminded me that we really should be guiding people to look at trusted sources for information. Somebody in your organization should be going to the WHO website and keeping an eye on what is coming, not just in your part of the world, but in other parts of the world. Don't be caught out, because you weren't keeping yourselves informed. There are lots of good sources of information. The Centre for Disease Control is another one. There's lots of websites out there. Have a look, read it. Try and go to the trusted ones. Try not to go to the ones with the conspiracy theories. They're not going to help quite so much. But WHO, CDC, governments usually do have good sources of information. So keep an eye on them. Now, if we can go on to the next slide, please. Troy, I want to come to you first. We're talking about embedding infectious disease management into your wider health and safety management system. But can we also look at some of those really common controls that just help? Because we haven't really talked about controls yet.
Yeah, so, and just building on what you were just saying, one of the real, I would say, disappointments of our experience through COVID was the lack of lessons from just 10 years ago, or 10 years before, which was SARS. And especially here in Canada, we had a massive commission. Big reports came out. It was called the SARS Commission, and they're like, it's the precautionary principle. And this is where we, and I literally wrote, and it was January 2020. I wrote this big thing to the membership. Said there's this new thing, this new illness. We don't really know much about it, but don't worry, guys, because we have the precautionary principle. So if it ever comes to Canada, we know that we're okay because we're going to follow the precautionary principle. And what is the precautionary principle? People are asking. Well, it's basically the principle that says you don't have to wait until you have scientific certainty about using controls if you believe those controls will help. So in the case of COVID, what's kind of borne itself out, this thing, you breathe it in. That's how you catch COVID. You breathe it in. And we kind of figured that. So basic controls, either, if you're in a crowd, use source controls, types of surgical masks that keep all your germs to yourself. If you are working in an area where you know that there's going to be an illness, that's when you'll need a respirator, actual personal protective equipment. But if you know for sure that it's not airborne, well, now we're talking about cleaning, we're talking about disinfecting, we're talking about making sure that you're avoiding physical contact as much as possible. And again, we start with the hierarchy of control. So wherever possible, we take measures to keep the illness out of the workplace. And some of that's screening, screening for sick people. If that was, I don't want to say SARS 1 was better, but the benefit of the first SARS was you had the cough and then you became contagious. So we were able to quickly figure out that if you're coughing, you're not coming into the workplace, and that prevented people from catching it. That wasn't quite the case with COVID-2, with SARS. So that with SARS-CoV-2, where the symptoms were all over the place, and we're still debating some of these symptoms in some quarters. So again, adopting the precautionary principle, I can't say enough about that. That has to be, if we're embedding infectious disease prevention measures into your OH management system, it has to be based on, I think, starting with the precautionary principle, which is if we think something will control the illness, then that's where we're going to go until we have complete scientific evidence to the contrary, that it's not necessary. We're going to get those protections in place. And then we're going to follow the hierarchy of control. So eliminate it, use engineering controls, use passive controls that we don't rely on people taking actions to benefit from, but things that are in the environment that keep you safe, things like plexiglass, things like checking the airflow, making sure that anything that we do put in as a control doesn't create other hazards. There was a lot of people throwing plexiglass up everywhere. In some cases that was good. In other cases, it actually disrupted the flow of air through the building. So it actually changed the way the air was flowing, and maybe didn't make things worse, but didn't make things better. And then we go into our administrative controls. So, what are the rules? What are things that we can change about our work processes and other things like that? And then finally, we have personal protective equipment. And like I mentioned earlier, personal protective equipment, we generally think of as being least effective control, but when it comes to infectious disease, a lot of times the personal protective equipment that is the last line of defense is the thing that keeps people safe, especially when we're talking about things like healthcare and working with people that are potentially impacted. So yeah, I think that kind of, and within the document we try to consider all of the different situations. And we link our controls to all of the different types of situations to which you'll be running in. So whether it's endemic, whether it's in the four walls headquarters, whether it's while you're out into the environment, we try to link all of our controls to the different areas that you potentially be exposed to an illness as you go through your workday.
And in our development, we did quite a lot of restructuring, didn't we? So we'd have long lists of controls here, 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 and then we go, oh, they're all the same. So there are some basic things that everybody can be doing all the time. Good hygiene. Hygiene makes a difference, and not just hygiene in the kitchen, food hygiene, which is of course very, very important, but all those surfaces that we touch, all of us touch all the time, they do get forgotten about when there isn't a pandemic on. So that's something that people can be doing to help limit the spread. Keep your staff washrooms, your bathrooms clean. Clean them more often. Spray things down. Put sanitizer out. Put sanitizing wipes out so people can wipe down their keyboards and their screens and the printer and the doorknob. All of those things. There are these basic things that we can do generally, whether there's a health issue or not known about at that time. Back to your precautionary principle. We know that this limits the spread, the transmission of infectious agents. So let's wait until there's a problem to do it. In terms of embedding this kind of management for infectious diseases into a management system for health and safety more widely, do you actually need to have a formal management system in place, Maria, or is it something we should be doing in a different way if you don't have it?
I think we should do it, even if we don't have a health management system, because we can. A lot of small enterprises don't have it, and so they have to manage the OH issues, and they can add that to the one they have. So I don't think it's necessary to have one of them. They can apply this kind of measures anywhere and in every place. So I don't think that there's the need to do that, and many of them don't have it. So we can ask to do it, not to do it because you don't have the management system. So I think we have to try to maintain this kind of thing that we learn with the COVID all the time, as you have said, because they can prevent some things to come, and then we will be in it will be something that we have internalized and do all the time. So we will be prepared for harder things to do if they are necessary.
Thank you. And Constance, most organisations in practice only have one management system, don't they, to run their organisation. Can you perhaps give our audience a little bit of the benefits of having a single management system that manages risks, whatever those risks are, whether it's health and safety or quality or environmental or business resilience?
Yeah, okay. Yes, most organizations you might find would probably have one management system in place. So take, for instance, the health and safety management system in place. Some might have an integrated management system in place. Beautiful. Right. But however, it's very important for us to take a holistic approach to risk management. By that I mean, instead of us just considering one risk, maybe to a fragmented risk, maybe to a function or to a department or to a process, it's easier for us to use one management system to actually considering risk from a holistic point, from a wider business point of view, right? So if we let's take, for instance, when we talk about the health and safety management system, which is the ISO 45001, it talks about, the clause 4 talks about context of the organization. And I usually would tell people, when we consider context of the organization, it's simply referring to gaining considerable insight into the wider business scope, right? The wider business risk of an organization. So it's not just about health and safety. It's saying, how do we understand the context of this business financially from all areas? And that's looking at the risk to that business, the risk of the organization holistically, right? So if we now take that, I mean, for most businesses nowadays, I would say that for any, it's easier, it's better actually to actually consider looking at your risk holistically rather than just managing them in silos, right? Especially in a world as ours that's changing so rapidly, right? The best kind of approach you want to look at it through. You can't have a health and safety management in place, but it would also help you to actually holistically consider your risk management. I mean, every resilient organization has that in common: holistic risk management. So I'll give you for an example just to drive this home. Let's assume that what do we use? Constance Group of Companies. Let's assume the Constance Group of Companies actually considers sells goods and services, right? This is a company that's selling a good, maybe XYZ goods and services. And then for one reason or another, we now have an issue that's related to health and safety. Remember, in this point, we are not looking at just health and safety risk, right? If we take it holistically, assuming that my company looks at risk as health and safety, the health and safety risk, but in the long run, you've got the wider business, right? The wider business risk, which my health and safety risk will eventually have an effect on. So if I have an issue related to health and safety, what happens, right? Maybe a fatality at work or whatever, business stops. That's a business continuity risk, right? From there, let's continue from there. If we have lost time in my business, or if we eventually have to stop that business at that time, right? It will take us over to a financial risk, because the company at the long run might end up losing some finances due to the inability to actually conduct business at that time. So now we have moved over to financial risk. Now consider that at that point where we now have the financial risk to look at, stakeholders are now thinking, no, I can't do business with a company that's not corporately responsible, right? Corporate social responsibility or whatever it is. And then at that time, we've moved over, and no one wants to do business with Constance Group of Companies. We've now moved over to a reputation or a brand risk, right? So you can now see the effect of actually not looking at risk holistically, right? For at the beginning, you just may have thought it was health and safety risk, but now we've been able to relate it to a wider business, which gives us the reason why we actually should be able to consider risk holistically within organizations, right? Because I mean, at the end of the day, it helps the business itself to actually attend to its what's the word to use now? If you have that holistic risk management in place, it actually helps the business to see things, to see the risk that could affect it better from different perspectives, right? So you can actually reevaluate and understand the nature and the type of risk that you actually want to undertake, right? So, I mean, holistic risk management is one of the best ways that you can actually achieve optimal results within the organization, right? Thank you.
Thank you so much, Constance. We only have 7 minutes left. We have quite a few questions, so I'm going to do a quick fire round of asking you some questions, very brief answers, please, and I may need to cut you off, so please don't take it personally. The first question I have here: if we start isolating ourselves for every minor illness, aren't we at risk of reducing our immune systems? So now we have minor diseases with a greater effect on people. Maria, coming to you first.
Well, I don't think we are talking about isolating, because we are going to be in public or outside in the street. We are talking about I think the problem is more related to being inside a place. where we have a relation with another kind of with another person. So if we get the disease, we are giving a boost to our immune system. So we are not thinking about that we are getting less prepared for another one. But I don't know if we want to get ill, because if, as I said, the piece of news that I read, that a quite mild illness can cause in the future a great harm to our health, it will be better not to get a mild one too. So I think that we have to look at it in a perspective. In the family, we will be living together, and we will all the flu, or we will try not to get our family with the flu. But I think that that's something we have tried to do in many cases, but we are not thinking of that consciously. We wouldn't want our sons or daughters or husband or wife to get ill because we are ill. So why we admit that to do that at work? So it's quite funny to think that at home no, but in the work it doesn't matter. So I think that we have to try not to spread anything to anybody if we can.
Thank you, Maria. And yeah, we really are running out of time, but very quickly, Troy, what is the role of artificial intelligence and nanotechnology in controlling, preventing, mitigating infectious diseases? Do you know? Are these at the forefront of this kind of area of work?
Well, I'm going to plead a great deal of ignorance. I've had a lot of experience working with standards around nano coatings and making products better using nanotechnology, and I think that's where a lot of the nanotechnology use in the kind of consumer products that we see are enhancing products, making them sleeker, faster, better, things like that. Are there folks out there researching molecular level science, and I mean that's really what we're talking about when we're talking about the new developments of new vaccines. That's a form of nanotechnology, because we're engineering things at the molecule. So will science continue to find better ways to keep us healthy and better ways to heal us after we get sick? I'm sure they will. Will people be very suspicious of the new technology? I'm sure that will continue to be a problem as well. And that's what rigorous science debates, and people with more PhDs than all of us combined will go, and they will figure these things out, and hopefully we'll move forward from there.
I'm going to have to unmute and then speak. I'm going to have to stop with the questions because we really are out of time. If we can go to the slide, please, on the timeline for 45,006, just to let everybody know that the document is currently out for public consultation. And we really, really want to hear your views. We want you to read it. We want you to ask the questions if they're not answered. Let us know if something doesn't make sense, or if you think our experts have got it wrong. Anything at all to improve this document. We are one world, and we're trying to keep each other healthy, and we've all got different knowledge and different experience. So please, go via your standards body to find out where you can comment. It should be through your national standards body. If you get really stuck, you can email me and I'll try and help you find where it's out for consultation, because we genuinely read every single comment that is submitted to us and discuss it at length, don't we, Troy? Until we eventually get to a place where everybody agrees this is a good change or a good addition or a good deletion if something's in there that is just not working. Publication of this document is likely to be middle of next year, but there is good advice in there already. If you are struggling through a flu season or struggling with COVID re-emerging in your organization, read PAS 45,005, but have a look at this too. None of the information is wrong. We may just not have written it as well as we could have, but everything in there is still helpful. If we can go on to the slide with our website on, please. I just want to remind everyone that this technical committee, ISO, it's an international group, 99 countries are involved and multiple international liaison organisations, and we are here to help. If there's any aspect of this subject or any other occupational health and safety management subject that you have a question on, you have a concern on, get in touch with us. Have a look on our website, there are resources on there, but if you can't find what you need, you can come directly to us via the email address there, which will be shared with all of you. And do get involved in your National Mirror Committee. You're hugely influential if you get involved there. Thank you very much for coming. I hope you've enjoyed it. Massive thanks to Troy, to Maria Nieves and to Constance for being part of this conversation today. I found it really interesting. I hope you have too, and I hope everybody's learnt something or been alerted to think about something maybe in a slightly different way. We look forward to seeing you again at our next round of conferences, probably in May. Thank you very much.